Patients who have just had cataract surgery at Virginia Eye Consultants will receive thorough explanations and written instructions for how to care for themselves just after the procedure. But this is a great opportunity to review those post-operative instructions as well as set your expectations for what your post-op vision will be like. Generally, expect that your vision will be a little bit blurry, but this should improve over the first few days. Some patients may be aware of a mild sensitivity to touch and may experience a sensation of grittiness or scratchiness that may last for a few days. We'll be giving you medication that should help with that sensation.
Following surgery, you will need to administer 3 different eye drops that are required to help ensure proper healing. All of these are administered only to the eye on which the surgery was performed. The first drop is an antibiotic used to prevent infection. This drop is applied 3 times a day for 1 week. The second is an anti-inflammatory drop that addresses pain and inflammation after surgery. This drop is used twice a day for 2 weeks, then once a day for 3 additional weeks. The last drop is also needed to address eye pain and inflammation and works well in combination with the first anti-inflammatory drop. This drop is just once a day for 5 weeks. It is not unusual to have an elevated eye pressure for the first few days after surgery. If your eye pressure is elevated, you may need to use an additional eye drop to help lower the pressure. Whether you're taking the 3 drops or the 4, we provide you with a drop instruction sheet to make it easier for you to follow the different drop regimens of each drop.
As for post-operative restrictions, modern-day cataract surgery has very few. With advances in procedure and surgical techniques, there are typically no sutures used and no patches are required. So you will feel like you can go back to normal very quickly. There are just 3 prohibitions in the first week following the surgery. No swimming, no gardening, and no eye makeup. Showering is okay, just try not to get any water in your eyes. And you can bend to pick things up, just make sure you bend at the knees and don't increase the pressure in your eye. It's completely normal for each person's recovery from eye surgery to be slightly different. Each person and each eye is unique in overall health, healing process, and tolerance to the eye surgery. So not only can the experience and recovery be different from person to person, it can also be different from eye to eye in the same person.